this video, I'm going to explain the need for anterior guidance in a very simple way, which you can also use to explain to your patients. Imagine a long table with multiple legs, say 9 pairs of legs. If you want to move the table, what will you do? Will you drag it with all legs on the ground? No. You will lift the table so that the last 2 legs are touching the ground, obviously, and then you will pull. That way, you prevent damage to the legs and the floor. Not only that, it is easier to pull the table with much less force, because you need not now have the friction of all the legs on the ground. In a similar way, when nature wants to move the mandible, imagine the mandible as a table with multiple legs. The 2 legs, the last legs, are the condyles, and they rest on a floor called the fossa. The remaining 8 legs rest on the ground called the occlusal surface of the upper teeth. You can visualize the mandible table resting on the fossa and the occlusal table of the upper teeth. Right? Now, when nature wants to move the table, it wants the same logic. Now, nobody is there in front of the table to lift it. So, nature makes the front teeth lift the table. So, when the jaw goes into excursions, the front teeth lift or disclude the posterior teeth. And when the last teeth, the legs, rest on the fossa, the condyles, the remaining posterior teeth are off occlusion. If during this movement the back teeth also contact, just like the table, you'll have the teeth getting damaged, broken down or periodontally become loose, muscle becomes spastic, and joint will get damaged. Now you know, through this example, how anterior guidance is very, very important in an occlusion. It is actually there for damage control during mandibular movements. Thank you for listening. Goodbye till we meet again in another episode.